Describe for me the difference in the American healthcare market between 2010 and today.
So 3 places it's different. With regard to access, the access that people have to affordable healthcare has changed dramatically. And with regard to quality, the quality of the offering is dramatically different for everyone, not just for people in the marketplace. The pre-ex, all those things that I went over, that is fundamentally different. And it's enhanced by other things like a reduction in readmissions. There's been a reduction of 565,000 readmissions into hospitals, and those were tools that were passed in the Affordable Care Act. And then the last place is actually in affordability. And while premiums continue to rise, it has been tamped down. And so those are fundamental changes that are going to go on and continue and be built on. And then there is this big change, which is that consumer at the center, where we're going to pay for the outcomes, where you're going to have better coordinated care and more prevention and wellness, and the data and information in the healthcare system will be used better.
The thing you haven't talked about with that consumer, though, because healthcare is bewildering, and much like you have to deal with your mom in the driveway, and I'm sure her healthcare, so too do we all have to deal with, my mom going to the doctor and being confused and all that jazz. Where's the education? Where's the thing that's going to make that consumer actually smarter, as opposed to the system getting smarter around her?
So part of that is in what the consumer is demanding, and meeting what the consumer is demanding. One of the things we announced about a month and a half ago was a bill you can understand. And so we actually are doing a competition. This is going out and sourcing for a bill you can understand.
A medical bill, hospital doctor's bill, right?
Yes, and your insurance bill.
Yeah.
That thing that everybody gets called explanation of benefits, it's as hard for me as it is for you. And so, things like that and actions like that, creating the tools, the consumer demanded the tools in the marketplace that didn't exist. And right now, when you go if you are a person who's going to shop on the marketplace, you can try and figure out if your provider is in that insurance plan, or will it cover your drugs? And creating tools like that for the consumer, how do we connect to the consumer? It's understanding what they need and then trying to meet those needs. And the other thing is forcing things that are consumer friendly. Like for your mother, I don't know if your mother's had the knee replacement or the hip replacement, but when she does, the issue of a bundled payment, what a bundled payment is you pay for the episode of care. So from the moment that person walks into her home and tells her, okay, put the dishes down here, because when you get home, you got to have the dishes here because you can't reach. That rug has to go, because when you're kind of still at a place where you're not lifting, get all those rugs, to the point of the anesthesiologist, to the physical therapist. They'll be paid together, and they're going to be paid for her success. So if you're the anesthesiologist, you're kind of interested in me, the physical therapist, doing my job right, because your payment is related to that. And so doing things like that that are more consumer-centric, but we have to help the consumer understand and listen to them. And that's one of the most important parts of this cycle, is consumer engagement.